Welcome to Module 3 of the Blackmores Institute Fundamentals course. This particular module is called Minerals in Health and Disease. Now, what are minerals? Minerals are essential nutrients. In other words, we must get them from the diet. Our body's unable to synthesize them, so we have to take them in from external sources. Now, what that can mean is that if we don't take enough in from external sources, we can start to get insufficiency, we can start to get deficiency as well. So a common example would be magnesium. When people start to run low on magnesium, what they tend to find is they can get muscle cramps or eye twitching, for example. If they become very low in magnesium to the point of hypomagnesemia, you can actually get fatal arrhythmias. So it can in fact be fatal. Now, there are other very common mineral deficiencies that we tend to see out there in the community. One of them is iron deficiency, the other one is zinc deficiency as well. And so it's really important for us to think about that when we talk to our patients, because chances are if they're not having enough fruit and vegetables on a regular basis and whole grains and all the right things in their diet, they could very well be presenting to you with something that might look like a sign or symptom of a deficiency. There's actually two ways that we can characterise minerals. We've got macro minerals and we've got micro minerals. Macro minerals are really defined by the fact that we need to have lots of them. So that would be things like calcium and magnesium. Then we have micro minerals, which we only need a very small amount of, but they are still very important. And that'll be things like iron, for example. One of the things that's really important to keep in mind is that there is a difference between the recommended daily intake, RDI, compared to a therapeutic dose. So a recommended daily intake is really just that dose that has been suggested as being the minimum amount required to prevent a deficiency. Now, that's not an individualised decision, it's actually based on population studies. So that's been based on typically a healthy male weighing about 70 kilograms, which really isn't representative of most people. So what some people might need to prevent a deficiency might be a little bit different across different people. Therapeutic dose, on the other hand, can be quite different, because there's one thing to take enough of something to prevent a deficiency, but sometimes we actually need higher doses to create a therapeutic effect, to really change some kind of biochemical process in the body towards producing a better healthcare outcome.